Utah's long-term care facilities are being hit hard by COVID-19, accounting for half of the state's deaths. ABC4's Brittany Johnson has more on what is being done to prevent the disease from spreading in these facilities and other hotspots across the state.
To date, there have been 32 deaths linked to COVID-19 in the state of Utah. Half have been among individuals infected with coronavirus at a long-term care facility. What is being done to mitigate the issue? Dr. Angela Dunn, the state epidemiologist.
Our Utah Public Health Laboratory has a mobile unit that is able to go directly to the long-term care facilities when we identify a case and immediately test all staff and residents. And that allows the long-term care facility to quickly separate the at-risk for COVID-19 or the positives from the negatives or people who weren't exposed.
Summit County has been a hot spot for the virus. Over the weekend, the area saw an increase of 13 cases.
Over the weekend, Summit County worked with the Utah Public Health Laboratory and Intermountain to actually proactively go out to specific hotspot sites throughout Summit County and do testing of both symptomatic and asymptomatic people. So that's likely the reason why we did see those 13 cases identified in Summit County, because there were specific targeted efforts going on over the weekend.
Health officials are also keeping a close eye on homeless resource centers in Salt Lake County after a recent outbreak.
We have worked to ensure that everybody who has possibly been exposed has been tested.
And a reminder, testing is free through the National CARES Act. Not only that, but care related to COVID-19 is also free as well, according to the state's epidemiologist.
And we really need people who have the most mild of symptoms to get tested so that we as public health can have really good data to identify the burden of spread across our state that will be informing policy and public health interventions.
Reporting in Salt Lake County, I'm Brittany Johnson, ABC4 News.